taken of the pleural surfaces. This is often a diagnostic intervention that results in a definitive diagnosis of malignant pleural mesothelioma. At this point, the patient typically is referred to a thoracic surgeon with experience in treating patients with mesothelioma. As is true with any cancer we treat, we stage every patient with mesothelioma. In other words, we determine how advanced we believe the cancer to be when we attempt to determine the best treatment option possible. We utilize all the data available to us, including the CT, PET-CT, MRI, tissue biopsy, and eventually a day procedure in the operating room called a cervical mediastinoscopy. This is a procedure where a small incision is made at the base of the neck and mediastinal lymph nodes are biopsied. We now know that if the mediastinal nodes are negative for cancer, meaning no cancer is present, that these patients live longer than if the nodes are involved with cancer. If we suspect the possibility of mesothelioma existing in the abdomen, we may perform a laparoscopy to assess. This involves going to the operating room where a small incision and cameras are used to obtain tissue to prove the presence or not of mesothelioma in the abdomen. There are two operations that thoracic surgeons may consider performing for patients with mesothelioma. These are named pleurectomy and decortication or extrapleural pneumonectomy. Pleurectomy and decortication is a surgical procedure that involves removing both the visceral and parietal pleura. This leaves the lung in place. This can be a potential option for patients with very minimal or very advanced disease. An extrapleural pneumonectomy is the complete removal of the lung with its visceral pleura, the parietal pleura, the diaphragm, and the sac around the heart, termed the pericardium. We then reconstruct both the pericardium as well as the diaphragm using prosthetic material. We believe extrapleural pneumonectomy to be the better choice for people who are strong, are younger, or who have more bulky disease. There is no gold standard therapy for mesothelioma. Your treatment plan depends on the anatomy of your tumor and your overall status.